Good morning, everyone. I'm really excited to be here today to talk about the importance of vaccines, especially as we all get ready to go back to school. I am joined today by Veronica McNally, president of the Fannie Strong Foundation and founder of the I Vaccinate campaign. I'm also joined by Dr. Tara T. Vincent Chambers, president of the East Lansing School Board, and also Linda Vale, one of the great public health champions and legends here in the state of Michigan and the health officer for Ingham County. And I'm glad that each of them will have an opportunity to share their expertise as well as their reflections on this very important topic. So, the past 18 months have been incredibly challenging. We've lost thousands of loved ones to this pandemic. Many, many more have been infected by this terrible virus. But I'll tell you, I'm hopeful. I am hopeful because modern science has given us the tools, and specifically vaccines, to be able to fight so many diseases, and that includes COVID-19. The CDC estimates that for children born in the US from 1994 to 2013, vaccination will prevent an estimated 322 million illnesses, 21 million hospitalizations, and 732,000 deaths over the course of those children's lifetimes. Now, that is a big deal. All vaccines that are available in the United States are tested through a robust process, including diverse clinical trials with data reviewed by doctors and scientists before people are able to receive them. Vaccines are safe and vaccines are effective. And they are not just about protecting you. They're about protecting the community, those who are elderly, those who may have weakened immune systems or are unable to get some vaccines. A choice to vaccinate is not just a personal choice. It's a choice to protect an entire community. Unfortunately, this past year, routine childhood vaccination rates decreased across all age levels, leaving more children and teens at risk of contracting serious or even life-threatening conditions that could be prevented. State data shows, as of this past spring, childhood vaccination rates have slipped below 70% in more than half of Michigan counties. This is very concerning. As we have seen with COVID-19 across the entire country, when an area has lower vaccination rates, it creates an environment where diseases can spread. And all it takes is one infected individual. So as families, students, teachers, and administrators prepare for this upcoming school year, I urge every parent to make sure their child is up to date on all of their vaccinations. And if they're over the age of 12, they should get their COVID vaccine too. Doctors' offices have the safety protocols in place to be able to take care of patients safely. So please do not delay. I can tell you, I'm a mother of 3 children. I've already taken all 3 of my children to the pediatrician this summer, and they are all up to date on their vaccines. And I feel so much better. I feel relieved about this upcoming school year because I know they are protected and we are doing our part to protect other families as well. So let me speak specifically about the COVID pandemic. Unfortunately, we are still in the middle of a pandemic. We are seeing our cases, unfortunately, go in the wrong direction here in the state of Michigan, with our cases going up and the percent of tests that are coming back positive increasing as well. And while we've made great progress with about 64% of people over the age of 16 having at least one dose of the 3 safe and effective vaccines, there's still work we all need to do to keep our kids healthy and in school, in-person learning. MDHHS has released guidance on how schools and communities can create a safer learning environment. So again, if a child is over the age of 12 and eligible for the COVID vaccine, they should get it. Universal masking is also recommended by the CDC and MDHHS for all teachers, students, and staff indoors, regardless of vaccination status. Physical distancing remains important, at least 3 feet. That's very important to prevent the spread of the virus. And of course, you should get tested. You should get tested regardless of your vaccination status if you have any symptoms or if you have been exposed to someone who has tested positive for COVID-19. And it will still be very, very important to work with school staff and public health staff on the important work of contact tracing so we find out who has been exposed and prevent the spread of the virus further. I also want to point out that while kids are less likely to get severely ill from COVID-19, they still can. And the more virus we have in the community, the greater the risk is that a child will also come in contact with the virus and become ill. And they can not only spread it in school, they can spread it to others in their household or the broader community, including those who may be at more increased risk of having severe illness. In-school learning is so important, but we have to be smart. We have to implement the right public health protocols. And please do not give up on this pandemic yet. We have simply come too far. With that, I'm pleased to turn it over to Veronica McNally.
Good morning. As Dr. Caldoun said, my name is Veronica McNally, and I'm the president of the Franny Strong Foundation and the founder of iVaccinate. I'm here today as a parent who lost a child to a vaccine-preventable disease. In 2012, I lost my infant daughter, Francesca Marie, to whooping cough, also known as pertussis. I want to encourage Michigan parents to contact their child's healthcare provider today to get their children caught up on their routine childhood immunizations and get their adolescents the COVID-19 vaccine. It is really important to do this to be safe and to be in school this fall. As you heard from Dr. Caldoun, vaccination rates in Michigan have dropped significantly for children ages 19 to 36 months. They've fallen below 70% in half of the state, more than half of the state, actually, 46 out of 83 counties. In 7 Michigan counties and the city of Detroit, the rate has dropped below 60%. And vaccination coverage in adolescents has also fallen since the start of the pandemic from 77% in January of 2020 to 73.7% in June of 2021. This means that in addition to being at risk for COVID-19, our children are susceptible to diseases like measles, chickenpox, pertussis, and more. While community immunity, which we've heard a lot about during this pandemic, is different for each disease and each vaccine, doctors and public health experts agree that a vaccination rate of around 70% is the minimum protection desired. There's no question that this pandemic has led to an increased risk of vaccine-preventable diseases, particularly among our unvaccinated children. And while we are appropriately concerned about COVID-19 right now, we cannot forget that with the spread of COVID-19 throughout the globe, vaccination programs have halted in many countries. This has increased the threat of the reemergence of these diseases that we've worked so hard to prevent through these vaccines. I think we all understand now that spread can start with one person. We simply cannot afford another outbreak or an epidemic of one of these vaccine-preventable diseases. So please take a moment to visit ivaccinate.org if you have questions about vaccines, because we have answers. This site provides the credible scientific information you need to make the best decision possible to protect your children from vaccines and from vaccine-preventable diseases. I vaccinate to protect my children and yours. At this time, it is my pleasure to introduce Dr. Tara Chambers, who is president of the East Lansing School Board. Thank you.
Good morning. I am just so pleased and honored to be standing here with this amazing team, a team that represents the thousands of people across the state of Michigan, especially our health professionals and educators who have been working tirelessly throughout this pandemic to help keep our community safe. What's most exciting to me about this event is the opportunity to highlight our common goals. I know that it can be tempting sometimes to focus on perceived disagreements, but throughout the last 18 months, I have been overcome by the consensus among these professionals. All of us are here today in our respective roles to recognize the importance of vaccinations for COVID, for those who are eligible, but also other childhood immunizations. On that note, I want to share some information about a vaccination clinic that we're hosting in partnership with the Ingham County Health Department here in East Lansing later today from 3 to 6 p.m. Families will have an opportunity to come to the Student Union at East Lansing High School at 509 Bertram Drive, right here in East Lansing, to receive not only the COVID vaccine for those who are 12 and over, but also important other vaccines for children. While we're hosting the immunization event here in East Lansing, I want you to know that this event is open to anyone. We suggest that you sign up for an appointment with through the Ingham County Health Department, but you can also just walk into this event today. We saw an incredible response to our last vaccination clinic a few months ago, and today's event will move us even closer toward our goal of providing the safest return to in-school instruction possible. As I said, from my perspective in East Lansing, the response by our families and community members has been overwhelmingly positive. Truly, I have been so proud of the way that our community has stepped up to follow all of the safety protocols that we have put in place with little complaint. And our vaccination rates have been really encouraging, but we still have some work to do. It is not time to let up. I'm urging everyone who is eligible to get the COVID vaccine. It is important also to stay up on other vaccinations. And of course, we will need everyone to continue to comply with the layers of safety protocols that we've put in place, including universal masking indoors in all of our buildings. Over here, we have an example of some of the effective tools that we have used in the past, but it's not something we want to see going forward. We don't want to see these kinds of shields on desks anymore. It's so important that we all stay up on our vaccinations. I can't help but point out that we're standing in the beautiful White Hills Elementary building, one of 6 elementary schools that has been newly constructed or remodeled in the last few years. Thanks to the support of our wonderful East Lansing community. And even these buildings have been an incredible tool during the pandemic, allowing us to socially distance and to better control the environment that our students are learning in during the day. As the president of our school board, I want you to know that we are committed to providing the safest return possible to school this fall. Personally, I'm hoping to provide in-person instruction on every day that we are scheduled to do so. And that is my goal, but it is not a goal that I can achieve by myself. I want you to join Tara's team and add getting your vaccinations, including the COVID vaccine if you're eligible, to your back to school planning list. And now it is truly my pleasure to introduce another shining light here in our local area, a key partner for us in East Lansing for sure, Linda Vale, Health Officer with the Ingham County Health Department. Thank you.
Thank you so much, and thank you for welcoming us into your district and your building today for this important event. I had to laugh a minute ago. It's like Dr. Caldoun and I picked the same statistics, and it's like, oh, look at that. We know what we're talking about, maybe. The World Health Organization lists about 29 diseases for which vaccines are available. Some of these vaccines are recommended for travel, but importantly, in terms of vaccines in the United States, there are 17 vaccines that prevent dangerous or deadly diseases and have saved countless lives and prevented just millions of illnesses. A vaccine protects you, and a vaccine protects others. And when we start talking about herd immunity, that's what we're trying to say. Seems to be a message that we can't get through, but just thinking about that vaccine as something that protects you is not enough. We have people in our communities always who can't get vaccinated for medical reasons. We have an obligation to protect those vulnerable people in our community by getting vaccinated around them, by creating a barrier for that virus to get into our communities and infect people. And we do that very effectively by having high enough vaccination rates around the vulnerable population that cannot get vaccinated. If vaccination rates went down, these diseases would come back, with the exception of smallpox, which has been eradicated. In 1974, about 80% of Japanese children were getting pertussis vaccine, whooping cough. That year, there were 393 cases of whooping cough in the entire country and not a single pertussis-related death. And then there was some scurrying and scrambling and concerns about vaccine that weren't true, and immunization rates dropped until about only 10% of those children were being vaccinated. And in a short time, by 1979, more than 13,000 people got whooping cough and 41 died. Those deaths were preventable. When routine vaccinations were resumed, those disease numbers dropped again. The National Geographic wrote an article, "The World Before Vaccines is a World We Cannot Afford to Forget." And yet increasingly, since these diseases are no longer seen, we do seem to forget them. But we need to remember this. An epidemic of rubella from 1964 to 1965 infected 12.5 million Americans, killed 2,000 babies, and caused 11,000 miscarriages. Since 2012, 15 cases of rubella have been reported to the CDC because of a vaccine that has 97% efficacy. In 1921, more than 15,000 Americans died from diphtheria before there was a vaccine. Between 2004 and 2014, only 2 cases of diphtheria were reported to the CDC because of a vaccine that has 97% efficacy. Chickenpox vaccine came along in about the early 90s, and my son was at the age where it had just come out, and it was kind of an iffy thing at the doctor's office that day about getting my kid vaccinated with a chickenpox vaccine. Because at that point in time, the insurance companies were really not sure they were going to cover it because it seemed more of a nuisance disorder or a nuisance disease than something that was really important to pay for a vaccine. And we quickly changed our minds on that. And I made the decision to get my son vaccinated despite the place we were in at the time. Each year, more than 3.5 million cases of chickenpox, 9,000 hospitalizations, and 100 to 150 deaths can be prevented by chickenpox vaccine in the United States. I heard somebody refer to COVID not long ago in a kind of a chickenpox sort of thing where it's like, you know what, instead of mandating vaccines, instead of requiring vaccines, instead of encouraging people to get vaccines as we have been, we should just, let things settle out for themselves like they did with chickenpox. We all got exposed and we got chickenpox. Well, I'm going to tell you that old-fashioned way of getting chickenpox didn't work so well when we're losing children. And by the way, some of us got exposed over and over and over again as children and had the unfortunate experience of getting chickenpox as adults. I was one of those adults. Chickenpox as adults is 25 times more deadly than it is in children. I ran a fever of 105 degrees or more for days. I was the sickest I think I have ever been with chickenpox as an adult. With the chickenpox vaccine now, we are avoiding those 100 to 150 deaths, and that's just basically the truth. We have an incredible opportunity in front of us right now with COVID vaccine. This vaccine is highly effective like these others that I've told you about, which means we can get to a point where COVID is a preventable disease. We owe it to our children, we owe it to our communities to end this pandemic and to get vaccinated. We need to do this before this virus continues to vary and eventually perhaps evade the vaccine, which is not happening right now. The vaccines are still very effective. Dr. Trey Dunbar said, COVID is a preventable disease. It's hard for us as pediatricians to see kids affected by a preventable disease. Children aren't like adults right now. They don't have the choice to get vaccinated. So yes, it makes a big difference when adults make decisions for kids and adults make decisions that could maybe prevent the diseases that we see in children. Children are being victimized right now by a pandemic that has a simple solution: adult vaccination, and actually 12 and older vaccination. Was going to end there, but I couldn't help but see this sign over here that says amazing things happen when we try. And we are going to continue to try to get every single person eligible for this vaccine vaccinated, because amazing things will happen. Thank you. And I bring back to the podium Dr. Khaldun. Thank you so much to our just incredible speakers, just for your leadership and partnership to fight this pandemic and to keep our kids and our families and communities safe. And with that, I think I'll open it up for a few questions from the media.
The Delta variant was known as, said it spreads as easily as chickenpox, and now we're worried about chickenpox possibly coming back. Can you guys talk about kind of what that means, how easily these spread from the classroom?
Yeah, we're really concerned. For every virus, there's always a rate or a likelihood that it's going to be spread from person to person. So with the earlier Alpha or B.1.1.7 variant, we thought that it could spread on average to 1 to 2 additional people. Now the Delta variant, we think it's even more than that. So every person who's infected, they're likely going to infect even more people, even maybe 5 people. And so that's why we're so concerned, is that every person who's infected can spread it to more people. And when you're in a setting where people are indoors, perhaps they don't have on masks, they're not vaccinated, all of those things add together to make it much more likely that the disease will spread.
Dr. Khaldun, in recent months, have you advised the governor to take stronger action to combat the COVID-19 variant?
You know, it's been an honor to advise the governor over the past 18 plus months of this pandemic. We are in constant communication about the data, cases, percent of tests that are positive. And I know she's got a tough job, but I continue to advise her as far as our guidance and what should be done.
So she should be doing more from a statewide level.
You know, I think it's tough. You know, Michigan as a state, we're not where a lot of other states, quite frankly, across the entire country are when it comes to our case rates and our percent of tests that are positive. But I'll tell you, there's no policy in my mind. There's never a policy that is entirely off the table. And I do know it's my job to always give the governor the best public health recommendations to keep people safe. So we continue to monitor the data.
Would one of those recommendations being mandatory vaccines?
We are not currently looking at mandating vaccines as a state government.
And why is that? If you guys, it's very clear you guys are extremely passionate and pushing about the importance of these vaccines. Why stop short of that mandate?
You know, I can tell you in public health, and I always say this, the work of public health is not just about the work of the public health department. I think we've learned throughout this pandemic that businesses have an incredibly important role to play in preventing diseases and keeping their employees and patrons healthy. And so again, we continue to work with them, work with our local health officers as well to make sure we're doing what we can to keep people safe. But at this time, we're not looking at a vaccine mandate here in the state.
And Michigan's
Someone?
sorry, and Michigan State University requiring vaccines right here in East Lansing. As far as I wonder about maybe someone faking a vaccine card or something, like what are the ways to tell if this vaccine, like if someone is like showing true proof of that vaccine?
Maybe I'll turn over to Linda Beal. So that card is not your official record. So there is an official record in what's called the Michigan Care Improvement Registry. And we are very well aware that those cards have been used and misused in some situations. And so when we are looking at truly trying to verify that somebody has been vaccinated, that vaccine card may or may not be sufficient to prove that. And in general, when you see places that do actually use the vaccine card as a means of verifying it, they do also say that there can be some serious penalties and fines for falsifying that. They are verifiable in the state's database, and they are verifiable in other state databases as well.
Linda, there's a question and some chatter online that I want either you or Dr. Khaldun, perhaps Veronica, to address this. Myocarditis and severe side effects in children or adolescents receiving the COVID vaccine. Can you speak a little bit about what the data is showing there?
That's a
Because
doctor.
I guess I'm the doctor. I'll step in. So of course, I mean, I'll say first of all that the protocols and the oversight of these vaccines and being able to pick up even very, very rare potential side effects is really important. It's the most robust, I'd say, in the entire world, the system that we have to check on the safety of any vaccine that's available. So yes, we do know that myocarditis is a very, very rare potential side effect of some of the messenger RNA vaccines, some Moderna and Pfizer. But I will tell you that from the cases that the ACIP, and I can have Veronica come up as well, but the cases that they've seen have been by and large very mild, and the risk of getting a heart inflammation or severe side effects is much, much higher if you actually get COVID-19. So of course, we are looking at any side effects, potential side effects, but by and large, the risk of those severe side effects are much higher if you actually get the virus itself.
And I just want to add that I have 2 boys who are in that age category for risk for the rare side effect of myocarditis, and they are both vaccinated against COVID-19 because I think it's that important.
Veronica, I have one more question for you. I mean, I think those of us and you guys, obviously, who have had the unfortunate distinction of walking around a COVID-19 floor or seeing this thing firsthand, not just through our lens or through you guys, understand a little more. Could you just maybe speak a little bit about the unfortunate circumstance with your daughter and just, I mean, I think you've changed your life because of this, right? Like this is now your sole mission, just more of like your personal story. Just elaborate a little more on it and just, I mean, I think if other people had felt what you felt, probably might not be here right now. I don't know if that's what you think. I'm curious about.
Yes, no, that's absolutely true. When Francesca was presenting with symptoms for pertussis, we didn't know what was happening. We didn't know why she had an almost unnoticeable cough. We saw 4 doctors who didn't recognize the signs and symptoms of pertussis. And when we finally figured out what it was, we took her to a pediatric hospital where she was immediately admitted into the intensive care unit. And it was just a few days later that she passed away. We were having her baptized as they took her from us. And when we hear people talk about COVID-19 and the pain that families are going through, I often think about the fact that COVID-19 is not all that different from the respiratory illness presented by pertussis. So yes, it is true that her death did change my life profoundly. And my mission in I Vaccinate is to make sure that parents have the most up-to-date, credible scientific information so that they can understand how safe and effective these vaccines truly are, and they can make that benefit risk analysis for themselves to do what's best for their children and get them vaccinated. And right now, that means getting them caught up on childhood vaccinations.
All right, let's take one more question. This will be the final question.
Dr. Collins, could you speak at all to how many people have registered as having religious or any other kind of exemption with the state or any kind of vaccination? And if you see that number growing as more vaccines are mandated?
I'll be honest with you, I don't actually know the exact number of people who've said they have a religious exemption. Where I don't think we're tracking that at the state level. Yeah, Linda. Yeah,
Speak a little bit to that. So we allow in the state of Michigan both medical, religious, and what we call philosophical exemptions. Some states only medical, some states only medical and religious, other states what we call other or philosophical. In general, so I don't have specific numbers on that. In general, what you see is maybe a 5% or so waiver rate in the state of Michigan. It's actually quite low, and in some places it's lower than that even. So it's a very low percent.
Could you talk a little bit about what that looks like? I mean, are they getting approved by you for that, or is that just them submitting?
No, a medical exemption gets basically done by a physician who basically understands what that medical exemption is and what it's for. The religious exemptions have to do with presenting that information generally at the schools. The schools are the ones that do that. The other or the philosophical objection recently went to a point where if you want that kind of waiver, you do have to come to the health department for an education counseling session so that we know people have informed consent about what they're turning down.